first, live, local. This is Fox 12 Now.
And we're back here on Fox 12 Now. I'm Greg Nibbler here in the Fox 12 Oregon newsroom, live streaming, covering a wide range of topics. Right now, though, we're going to be talking about Dress Blue Day, which is actually today, depending if you are watching live, March 5th. But more importantly, it has to do with colon cancer awareness. Now, this is something that, we've seen a lot of people affected by this. James Van Der Beek, the actor who just succumbed to this, and it's happening in younger and younger people. And we're going to talk to a doctor, Dr. David Parsons from Kaiser Permanente Northwest. This is a conversation that I had with him just about that and about some important things to know and ways that you can perhaps prevent or at least catch something like this earlier. Really important information for yourself and your family and friends. So let's go ahead and listen to Dr. David Parsons right now. Doctor, thank you very much for having time to talk to us today. I appreciate that. And I want to start off here, just by maybe giving everybody just some facts about colon cancer and about what the big things are that people should know and how it's affecting people right now.
Yeah, thanks, Greg. The colon cancer is a fairly common thing in the United States and in the world. It's the incidence in the United States is about 150 to 160,000 people per year being affected by colorectal cancer. That includes colon and the rectum, which is a little bit. It's all part of the same tract, but we treat them a little bit differently. So they separate it out statistically. That incidence has actually gone down slowly over the years in the general population, but what's concerning is that it's gone up in people under the age of 50. In fact, it's 20% of all colorectal cancers affect people under the age of 50, and that is about twice what it was back in 1995. And those rates are going up by about 1% to 2% per year. So that's what's concerning. We still, we treat a lot of people with colon cancer for cure. And what we're not necessarily measuring is the number of cancers we're preventing by doing adequate screening, because colon cancer can be prevented if screening is done appropriately.
Is there any kind of indication as far as why those rates are going up with the younger population?
Yeah, some of the theories involve our environment. So food that we eat, obesity, which is on the rise. It's also related to smoking and alcohol. And those are the main risk factors. There's things we may not know, like there may be a genetic change that's happening as well, but for sure the incidence is going up.
And you mentioned it's can be preventative if people can screen for it ahead of time. So can you walk us through some of those different ways that people can try to get a head start on this in case there is an issue?
Sure. What I mean by it's preventative is the majority of colorectal cancers come from polyps. So if we screen and we can remove polyps, we can prevent cancer. Alternatively, if we screen, we can detect cancer at an earlier stage and treat for cure. There's a couple different ways to screen. The most common one, and the one we use for most patients at Kaiser Permanente, where I practice, is doing stool testing, like FIT testing, which stands for fecal immunochemistry testing. That's a test that can be easily done at home in the privacy of your own home. You sample a little bit of your stool, send it in. We're checking for small amounts of blood. And if there are small amounts of blood, then you go on to additional screening like colonoscopy to look for polyps or cancers. There's other things people might have heard on TV about Cologuard, which is similar to FIT testing, but tests for small amounts of DNA in the stool. But these are things that people want to do on an annual basis, the stool testing. And when it turns positive, we go on to do other things if it turns positive. And that should start at age 45, again, because of the higher incidence now of colon cancer in younger people.
So starting that screening early, what are some other important things that you think everybody should know about this?
I mean, about the screening in particular, it's very easy to do. Even colonoscopy is a very safe procedure, comfortable with the medications that we usually give. And the It's so important to screen. This is colon cancer is the second leading cause of cancer death in people under the age of 50. And if we can get people to do the testing, which is so simple, then you can prevent going through the getting cancer and having to deal with that and having your family deal with it and all that.
What would you say to people out there? And I know you just referenced it a little bit about how easy it was, but just to re-emphasize that for people out there who may be, quite frankly, scared to go ahead and get that test, or they're worried it's going to be something uncomfortable, or whatever those factors are that are preventing them from getting in, what would you say to them to encourage them to go in and do this?
Yeah. First of all, not everybody needs colonoscopy. We do colonoscopy primarily for high-risk patients or if the stool testing is positive. The majority of people will have a negative stool test. But if you had colon cancer or polyps, you want to know about it. And then when you do go in to have colonoscopy, we're all very professional when we do it. It doesn't take very long. You do have to clean out your bowels the day before, which most people say is the least pleasant part of the ordeal. Once you get there, we give sedation through an IV, and most people are completely unaware of what's going on, have no pain or discomfort during or after the procedure. It's very safe. There's a small risk when we do it, but it's a very small risk.
And overall, this is something that can really prevent any kind of these issues, a lot of these issues developing later down the line.
Correct. Yeah. I mean, if we find polyps, and we do find a lot of polyps, and we take them out, we're essentially preventing cancer from occurring down the road.
Doctor, any final things that you want to let people know? I mean, you've shared a lot of information here already.
I think it's just important, starting at the age of 45, to talk to your care team, your physician, anybody else who's helping you with your health, and get the stool testing. It can actually be obtained without a physician from most pharmacies, but you need to be able to receive guidance on what to do if it is positive. So it's best to work, I think, with a healthcare team. Get the screening done. Let's reduce the chance of everyone getting colon cancer, and know that even if we detect cancer in an early stage, the outcomes are really quite good. At Kaiser, we have an amazing integrated team of oncologists, radiation oncologists, surgeons, and others taking great care of patients, and we've shown that with there's a study out of our Northern California Kaiser Permanente that shows that with screening of any sort, that the incidence of colon cancer goes down by 1/3, the death from colorectal cancer goes down by 1/2, and the disparities between races and ethnicities is eliminated through adequate population screening. And historically, people who are not Caucasians will have a higher incidence of colorectal cancer and worse outcomes. That's a race and ethnicity disparity that we've been troubled with for a long time, and that's improved with adequate screening.
Fair enough. All right. Well, Doctor, thank you very much for joining us. I appreciate your time, and we'll get this information out there.
You're welcome. Thanks, Greg.
All right, so good information right there, important for those screenings, and just a good reminder, something that could be preventative or catch that early enough. And thanks for joining us here. This is Fox 12 Now. So we do cover a wide range of topics. If you just tuned in right now, we've covered a lot here today on this show. We start at 1 o'clock, we go all the way till 4 o'clock if there's breaking news. We are going to sign off right now. We'll switch our programming over, but if anything happens in the next half hour that's breaking newsworthy, we'll bring that to you right here. We'll send out a notification and you can join us on this live stream. And if you're watching after the fact, thanks for doing that too. And in case you don't know, there are Fox 12 Oregon apps for Fire TV, Roku, and Apple TV. All three of those are great ways to watch this show and everything else that we do here at Fox 12 Oregon. There's plenty of on-demand content for about anything you can think of that's there that you can check out, and lots of investigative pieces. All of our interviews are there, in addition to like Good Day Oregon, or say you want to rewatch a newscast. That's where you can do it. It's all going to be on those apps, so just go to your app store and download those. But for right now, we'll sign off. We'll talk to you soon. I'm Greg Nibler. This is Fox 12 Now.